Professor, your takeaway from this G20 virtual summit?
Well, Asieh, we've got a global problem, and there are lots of spillovers. And President Xi is right. There needs to be a coordinated response. The G20 is an informal organization. It's an international group of leaders. And this statement that they made and what they do at this high level is very aspirational. It's very much...
Which statement are you talking about? About President Xi saying the health ministers need to get together and fight this pandemic?
No, I'm sorry. I meant the G20 statement.
Oh, okay. Got it. Okay.
This morning. So they made a statement that your correspondent Nathan King referred to, saying, there are a lot of things we want to do. We want to minimize disruptions to trade. We want to coordinate on public health. We want to inject $5 trillion in the global economy. But what's missing is specific commitments and accountability for actually doing these things. And we've got a global crisis where, as you've been reporting, in China, the level of infection has declined, but in the United States, it's risen. And what needs to happen is there has to be coordination to make sure that there isn't reinfection from one country to another, and that supplies of medical equipment and testing equipment is shared in a way that it goes to the sick people instead of being warehoused. And also food has to get to the people who need it.
Well, Professor, that all sounds great, but how realistic is this to make this happen with so many different countries involved?
Well, I think the ministers, as President Xi said, have to get together and hash through the specifics, make specific agreements that they'll be accountable for. And we need to work together to develop this vaccine that will get us out of this mess. We need to work together to take care of people in poor countries who will suffer even more than people in wealthy countries. We need to work together to coordinate on travel restrictions so that there isn't reinfection from one country to another. So there's a lot that needs to be done to coordinate, and our institutional mechanisms, even the World Health Organization, which is an excellent institution, has very weak enforcement capabilities, and the obligations under its international health regulations are not specific enough.
Professor, what about the role of the International Monetary Fund? Kristalina Georgieva, IMF chief, is basically calling on countries to double their emergency financing capacity, and she seems to be mostly worried about emerging economies and developing countries. She does have a point here.
Yes, and there's a big job for the IMF and for the World Bank Group and for countries generally. Many people are being put out of work. Our costs of providing health care are very high. So we've got a worldwide recession, and we've got to find a way to pull ourselves out of it. The first thing we have to do is solve the disease issue. But the second thing, and almost important, is to solve the economic issues. And a lot of countries are going to be spending a lot of money, including poor countries who don't have much money. They're going to need to borrow that money from the IMF or from the World Bank, and they've already got a lot of debt that they're not going to be able to service. So we need to find a way to work out their obligations so that they can manage, so that their people can be taken care of appropriately.
Important points you've made. Thank you so much, Professor Joel Tractman.